exploring depression, its symptoms, and evaluating the effectiveness of current treatments. This presentation explores depression, its symptoms, and critically evaluates the effectiveness of selective serotonin reuptake inhibitors, also known as SSRIs, psychotherapy, and combination therapy. We'll be splitting this into 4 different parts, starting with what is depression, symptoms of depression, treatments for depression, and the critiques for the treatments for depression. What is depression? Depression, also known as major depressive disorder, is a mental health condition characterized by a persistent feeling of sadness and loss of interest. It can lead to a variety of emotional and physical problems and can decrease a person's abilities to function at work and at home. There are different types of depression, and within that there are different levels. So it could be something that has transpired in all of us, but it hasn't gotten to a thing where we would have to seek out medical advice or even be diagnosed with depression. But obviously today we'll be concentrating on the more higher levels or more extensive levels of depression. So what are the symptoms of depression? We're going to start by stating 8 symptoms of depression. These are the most common symptoms that you may find in people experiencing depression. So we have a persistent sadness or low mood. So this is a continuous feeling of sadness or hopelessness. And when we say continuous, we mean something that's been prolonging for weeks or months. It's like a fleeting feeling of sadness. Then we have loss of interest or pleasures in all or almost all activities. Then we have a significant weight loss. So if we have a change in our appetite, and that's either, could be either side of the spectrum of we have an increase in our appetite, which is causing an increased weight gain, or we have a decrease, which is causing us to rapidly lose weight. Also, we have sleep disturbances, which, just like the change in appetite, could be either side of the spectrum. That could be insomnia, where we're barely getting any sleep, or hypersomnia, where we're sleeping nearly every day. And obviously, both of these affect our day-to-day lives. We also have fatigue or loss of energy, so persistence of tiredness and just overall lack of energy. Feeling of worthlessness or excessive guilt. So just for no reason, just feeling just really guilty and feeling really worthless with just anything really. And then we have a difficulty of concentrating. So obviously, this is we're not able to concentrate in our day-to-day activities, which is really getting in the way of us actually finishing tasks. And then we have reoccurring thoughts of death or suicide. So obviously having thoughts of death and suicide at all is not really common, but having it be a reoccurring thing is really when we need to actually seek help to see if there's anything that can potentially help. To be diagnosed with depression, you do not have to have all of these symptoms. You can literally have 1 or 2 of them and still have depression. And also, if you don't have any of the symptoms that were stated, it doesn't take away that you may actually still have a feeling or actually still could be experiencing depression. Moving on to the next topic. So for treatments for depression, we'll be looking at 3 different types. We'll be looking at medicinal therapies. So as previously stated, SSRIs, which are usually prescribed to individuals who are experiencing depression. A study that was conducted found out that SSRIs are more effective than other antidepressants and placebos in treating depression. So obviously, like all things, there are many things that work for some people that don't work for others, but there has been a multitude of cases that show that SSRIs were successful in treating depression in some individuals. Then we'll be going on to psychotherapies, specifically CBT, which is cognitive behavioral therapy, which is the most common type of therapy. CBT is a type of treatment to treat depression that involves talking therapy, which aims to identify and challenge negative thought patterns and behaviors. There was another research study that found that CBT is just as effective as the medication used to treat depression and has a lasting effect beyond treatment. CBT compared to SSRIs is a bit more time-consuming type of therapy, whereas SSRIs is a bit more of an immediate treatment. So with CBT, which we'll discuss more later, it just involves more of the more time because it's just a talking therapy, so you're delving into like a lot of different topics and areas, which does take a lot of time, and it also takes a lot of effort from the patient, which sometimes gets into complications, but as I said, like we'll get into that a bit later. So finally, we'll just go talk about combination therapy. Combination therapy combines both pharmacotherapies and psychotherapies. This is the most often recommended for severe or treatment-resistant depression. There was a study found that combination therapies result in higher remission rates compared to either treatment alone. Well, now we're going into critiques for treatments for depression. Criticism of the treatments for pharmacotherapies are the side effects. So SSRIs are found to be linked to a range of side effects such as sexual dysfunction, weight gain, and sleep disturbances. A study by Ferguson, 2001, showed the impact of the side effects, noting that they can significantly affect patients' quality of life and adherence to treatment. There also has been increased suicide in youth. There has been evidence to suggest that SSRIs have been linked to suicide in children, adolescents, and young adults. A study conducted by Hetrick et al. found an increase in suicidal thoughts and behaviors, which led to a black box warning by the FDA. So obviously with medications, there are gonna be side effects with like all medications. There's just gonna be like withdrawals and genetic, because obviously it's affecting you on more of a genetic basis in comparison to like other talking therapies. So criticisms of psychotherapy is the inconsistent outcomes. So the efficiency of psychotherapy varies greatly between individuals. A meta-analysis discovered that while psychotherapy is typically successful, there was great diversity in outcomes, with some patients experiencing major gains while others seeing little to no improvement. Factors contributing to this diversity include depression, severity, patient participation, and therapy relationship quality. Inconsistent outcomes call into question the effectiveness of psychotherapy as a standalone treatment. This variety needs a more personalized treatment strategy, as well as the evaluation of additional or alternative medicines for specific patients. Also, this time intensiveness, which we did previously mention before. So psychotherapy typically requires a significant time commitment with sessions often spanning several months. A study by Swift et al. Found that the average dropout rate from the psychotherapy is around 20%, often due to the time commitment and other logistical challenges. The time-intensive nature of psychotherapy can deter individuals from starting or completing treatment. This is especially problematic for those with demanding schedules or limited time or availability, potentially leading to the incomplete or ineffective treatment. So due to like the amount of dedication you have to do CBT could really weigh out if it's going to be effective or not. So obviously when people are committed, they have like really good long-term effects where it really does help their depression and lets them lead a normal, well, not a normal life, but a life that doesn't involve feelings of depression. So we'll lastly be talking about the criticism of treatments for combination therapy. Combination therapy is a more expensive type of therapy due to the combined cost of medication and psychotherapy. Research conducted by Payne et al. 2005 found that the cost of combined treatment is significantly higher than either treatment alone. The higher cost of combination therapy can limit its accessibility, particularly for those who have low income families. Also, there's a limited long-term efficacy data. There is sufficient evidence showing the short-term effectiveness of combination therapy. However, there's a lack of data on its long-term efficiency. A research study pointed out that most studies focus on short-term outcomes, with fewer studies examining the long-term benefits and potential risks of sustained combination therapy. So obviously with this information, it does affect the validity of if combination therapy actually does work. Because although you may have short-term effects for maybe even within the year, the real thing that we really want out of these treatments is to have a lasting effect where we don't have to then result back to having those feelings or going back to those symptoms of depression. I would lastly like to refer to just all my references that were used in this presentation, which is just on this slide here. Thank you.